tibiofemoral joint. Primary motions we'll be doing are flexion, and knee extension. This is considered a concave on convex joint with the distal component, the tibia, is a concave surface, and the proximal component, the femoral component, the femoral condyles, are convex. So with this case, it's going to go in the same direction. So a posterior glide will promote knee flexion, and an anterior glide, which I will have them flip over in a minute, will promote knee extension. So depending on what they're lacking. The loose pack, open pack position is approximately 25 degrees. There's different ways you can do this mobilization. You can have the patient seated, you can have the patient supine with this. Some people have them even prone for this, for the posterior glide. I think seated works out fairly well. You want to make sure you stabilize proximally, and then you'll be mobilizing. With this case, I'll get a nice squatted position, have the patient down approximately 25 degrees knee flexion. Everything else is in neutral. Find the joint line, so the superior aspect of the tibia, and again, the force should be exactly parallel to the joint surface. You don't want to be pushing down at the floor or in a oblique position. So slight distraction, grade 1 distraction, and then I will apply my force right through the forearm, straight back in that way. So slight distraction, again, grade 1 distraction, small oscillations, no stretching, small quick oscillations beginning the range. Grade 2, still no stretching, larger oscillations. Helps with nutrition of the joint, decrease pain, and indirectly helps to decrease swelling and increase range of motion. Grade 3, mid-range, all the way to end range. Larger, slow oscillations, not coming all the way back up. And grade 4, all the way to the end available range, and small, quick oscillations. You can also change your hand position. Might be able to visualize better here. Again, holding open pack position. Slight distraction, grade 1 distraction, mobilizing like so with the force going through there. Again, you don't want your hand too distally because you may get some torquing, rotation at the joint. You want to be right at the joint line. You also want to hold it here, and you want to make sure there's no motion like such. So everything's straight. Shouldn't be any substitute motion. If he was out too far, let's have you slide out just a little bit, and I'm mobilizing. You'll see the femur will tend to move too. So you want to make sure you block as close as you can to the joint line. So that's a posterior glide to help with knee flexion.